Every week, I meet people who ask the same question. How do I know if I'm ready? It's not just physically, but mentally, emotionally, and practically. The truth is the best results happen when you're ready, not just when your eyelids are. So today, I want to walk you through what readiness really means for eyelid or brow surgery and how to know when it's better to wait.
Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the Natural Look Blepharoplasty technique.
Let's start with the obvious, physical signs. If you notice that makeup disappears on your upper or lower lids, that your eyes or brows feel heavy by the end of the day, or your vision starts to feel shadowed by excess skin, those are functional and cosmetic indicators that you may benefit from surgery. Some people also notice that fillers stop helping. Filler can camouflage hollowness or asymmetry for a while, but once skin redundancy or fat prolapse becomes the issue, it's no longer the right tool. Other good indicators are the crease on one side is higher or hidden, you're starting to look tired even when you're well rested, or your brows are drifting lower, changing your natural expression. These are physical cues, but they only tell half the story. Eyelid and brow surgery isn't just about appearance, it's about identity. You need to feel ready to see subtle but permanent change. Ask yourself, am I doing this for me or to meet someone else's expectations? Do I have realistic expectations for the outcome? And am I emotionally prepared for the healing process, the swelling, the waiting, the gradual reveal? How do I feel? Am I at a right place, a good frame of mind with life? Do I feel like I'm at a happy place? These are things that I like to gauge in my patients to make sure they're at a right place at the right time for the surgery. Patients who are ready come in calm, curious, and committed. They understand that this is a process and not just a quick fix. That mindset is one of the strongest predictors of satisfaction. There's also the practical side. Things that most people overlook. You'll need time off from strenuous activity for at least 14 days. You'll need help for the first night after surgery, someone to drive you home and assist you with medications, assist you with icing, assist you if you need to go to the restroom. And ideally, you'll set aside a week before you don't have to be on, like no major events, no Zoom calls. If your life or work schedule can't allow that window yet, it's better to wait. Rushing the process creates stress, and stress delays healing. There are times I tell patients to just pause. If you've had recent Botox, I usually recommend waiting a few months to avoid interference with tissue planes. If you've recently had fillers, especially to the lower lids, and you're considering having lower lid surgery, then we have to get the eyelids ready for surgery, and that will require dissolving the filler and taking some time in doing that, and we'll go over that with you. If you're managing a medical condition, you have unstable blood pressure, or newly diagnosed thyroid issue, or newly diagnosed diabetes, surgery can wait until everything's controlled. And if you're in a big life transition, a move, grief, burnout, sometimes your body is saying, let's stabilize first. Surgery should come from a place of readiness, not reaction. The moment you're ready is usually quiet. It's not impulsive. It's when you look in the mirror and think, I'm ready to look how I feel again. That's when the timing aligns, emotionally, physically, and practically. That's when you'll heal better, look more natural, and feel generally confident in your decision, and have a great experience during the whole process. If this helps you understand where you are in the process, explore our educational videos on eyelid anatomy, recovery, and healing science. And when you're ready, truly ready, we'll be here to guide you. Subscribe for more insights on natural rejuvenation and the art of looking like yourself again.